our career chat on speech and language pathology, also called SLP. And we are fortunate enough to have two center alums in the field joining us. And we have Ashley Redenbaugh. She is in Shelby County. She works in the school. And then we also have Emily Miller, and she works at Blount Memorial Pediatric Rehabilitation in Tennessee. Is that the Knoxville area, or close?
It is right outside of Knoxville, yes.
Okay, right outside of Knoxville. But they are going to talk about their career path and their experiences and give you some general information about the field. And then after that, we'll take questions. So, Emily, I think, is going to kick us off. Thank you both for being here.
Thank you. Hi, I'm Emily Miller. I'm a 2006 center grad, and I currently live and work in Maryville, Tennessee, right outside of Knoxville. So I work for Blount Memorial Pediatric Rehabilitation. So we're under a hospital, and we're an outpatient pediatric clinic. We see children from birth to about age 16 with various kinds of disorders. And we have also physical therapists and occupational therapists here as well. We see somewhere between 100 and 115 children a day, so we stay very busy. It's kind of hard to find a quiet space here, but here, this is my little therapy room, so you can kind of see the animals, the barn and stuff behind me. So I've been working for the hospital. I've been in the same job since I graduated from grad school from University of Tennessee, Knoxville in 2009. And I really was excited to talk with you all today and get this opportunity because, one, I'm very passionate about my job and extremely happy with my career choice. And I loved also my center experience and really think that Center College really helped not only in solidifying my career choice, but also just in giving me the background I needed in what I do. So I was an English-Spanish double major at Center, and I wasn't really sure what I wanted to do career-wise. I became interested in speech-language pathology about my junior year, and the Career Center got me in contact with several alums who were speech-language pathologists. I contacted them through email. I spoke with a few on the phone, and I was actually able to go and meet with a speech-language pathologist who worked in a hospital in Lexington. So that was a great experience. And then my senior year, I was able to do an internship with a local speech-language pathologist at Kentucky School for the Deaf, which was an awesome experience. So then I applied to several grad schools and ended up coming back where I'm from to Knoxville and went to the University of Tennessee, Knoxville. So since Center doesn't have the communication disorders major, I was in grad school 3 years to get my master's instead of 2. So the first year was just catching up on all the undergrad courses, and then the 2 years master's program, clinical program there. So I really, even though I did the extra year, I really think it was well worth it. I actually got better grades in grad school than at Center. So I felt very well prepared. And in grad school, most of the time you're going to end up doing, most people do comprehensive exams at the end before you can graduate and get your certificate, but I chose to do a thesis project. And I worked with a professor at Center and did a pretty big research project on a rare syndrome called Charge syndrome. And that ended up being published in a book in 2010 about Charge syndrome. So I really think the English background was very helpful for all the writing and the research there. My last year in grad school, I was in a placement with the hospital here, Blount Memorial Hospital, actually in acute care with adults. So what I was doing is, seeing adults for modified barium swallow studies, which is kind of X-ray video of someone's swallow, and then treating adults with swallowing disorders in the hospital setting. And they had an opening in the pediatric center, which is what I was interested in. So I've been here ever since. I love my job. I think it's kind of funny because I get paid to play. I see most of my patients are between 2 and 4 years old, and the majority of them have receptive expressive language delays. Could be with an unknown reason, or it could be related to various disabilities or syndromes. So we see children with Down syndrome, autism, cerebral palsy, and like I said, various rare genetic disorders as well. So a lot of what I'm doing is sitting in the floor, playing with kids, and teaching them to make different sounds. Play skills are really important for language development. So with the really young ones, that's what we're doing, and we're teaching parents how to play with them to promote communication skills and things like that. We also see children with feeding disorders, and that could be from as early as, birth to children who are in their early teens that may have different feeding difficulty, chewing, swallowing, or sensory disorders, sensory aversions to certain foods. So we also play with food here and teach parents different ways to help their children learn to chew and swallow and try different kinds of foods. So we have, a kitchen here. We see babies too and help them with bottle feeding, and work closely with various doctors in the areas, gastroenterologist, nutritionist. So there's a lot of collaboration with other professionals, and obviously collaboration here with my other physical therapist and occupational therapist. It's a great atmosphere because it really is helpful sort of to see the whole child and see what they're doing in the other therapies. So sometimes, if appropriate, we might co-treat with an occupational therapist to help get the most out of the session. Typically, I see between 8 and 12 children a day, so they're about 30-minute appointments each. The therapy appointments are, and then I have time in between for documentation. So we have, it's pretty succinct. Most of our documentation is, and then how we get new patients here is we have to have a doctor's order. So we go through their insurance, we get a doctor's order, we evaluate them, and then I determine, whether or not I'm recommending therapy. We send that back to the doctor, and the doctor, agrees or not to sign the order and send them to therapy here. So we work really closely also, with the families and helping them learn how to help their children learn to talk, eat, different kinds of things. So it's very, very rewarding. Often we're the first ones with the families when their child says their first word and takes their first bite of certain foods, takes their first steps. And we work closely with a program in Tennessee called Tennessee Early Intervention System. So they serve children under the age of 3, and if they have certain percentage of delays in different areas of development, then they help to pay for any kind of services they need, like speech therapy, occupational or physical therapy here. So we work closely with them. And then also when I started working here, I found out that there was a pretty large Spanish-speaking population in the area, and we have several that come here. So, at first I worked with an interpreter just because I didn't feel quite comfortable enough, because after being out of center for 3 years, I didn't really have a lot of practice in grad school with my Spanish. But after, getting some experience that first year, now I see several Spanish-speaking patients, and I provide the therapy in Spanish. So I'm one of the only bilingual SLPs in the area that I know of. So I probably have 40 to 50% of the patients that I see speak Spanish, or their families speak Spanish. So for the younger children, I usually provide the therapy in Spanish, and for the older children, it just depends on the family's wishes and what they would like to do. But so that has been very helpful. So any other second language abilities are greatly helpful in this field. And like I said, I really like where I am, but the great thing about speech language pathology is that there is so much variety of different settings. So an acute care hospital setting or even an assisted living or nursing home setting is going to be so much different, and a different change of pace, and you're going to be working with different kinds of patients there. Obviously the school setting is very different. So, you know, if you I know a lot of careers you might have burnout in certain areas, but I feel like there's so much variety to move around, and there's you know, going to a new job is like in a different setting is sort of like starting over. So I like those opportunities. There's a lot of opportunities also for like travel SLPs are in high demand. You can work for a contract company and work for several different settings. Even here at the hospital, I mostly worked in the pediatrics, but there was a need for somebody to go out for home health and work with the geriatric population. So I did that for a short while, which was a great experience. So one thing, I just think this career is every child and every patient is always a new challenge. And there's just, even though we're doing a lot of play and it looks like a lot of fun, there's a lot of problem solving and that goes behind it. And I really, you know, like I said, I feel grateful for Center. I feel like it really helped prepare me just to go on this path. And like I said, it's been very rewarding, and I would be happy to talk with anyone or email with anyone who is interested or has any other questions. So thank you guys.
Thank you. Ashley?
All right, my turn.
Yep, you're up.
Okay. My name's Ashley Redenbaugh. I'm a 2003 graduate of Center, and I did not have any idea what I was going to do when I left Center. I was debating dental school. I was debating just getting a job, and I applied to one grad school and said, if I get in, I get in, and this is what I should do. I'd originally thought I was going to be a teacher of the deaf, so knew I kind of wanted to work in this area a little bit, but I have moved around in the field of speech a ton. I started off in the public schools and in Jefferson County in Louisville. There are 130 something SLPs in the school system in Louisville. My caseload was huge. I had elementary through high school. I might have even had a couple preschool classrooms. And after 5 years, I needed a break. I needed to get out of that situation because it's a little difficult sometimes to explain that you're not a teacher, that you do something very specialized and you've had some intense training in areas. I've worked with a developmental pediatrician, psychiatrist, and psychologist in a very small private practice. I worked in an outpatient clinic with OT, PT, and then now I am in a high school setting in Shelby County, Kentucky, so not super far from Center. But high school is a unique challenge because I am smaller than most of the people I see. I do a lot of argumentative communication work. So figuring out why in high school we don't have a communication system for certain kids. It's a little tough at times, but I have really good teachers I work with. I serve both high schools in Shelby County. So right now I have 5 different complex needs rooms, which are any kid that has the disability that they feel needs a smaller classroom. So most of the classrooms have 8 or 9. One of them actually only has 2 students, both nonverbal. One is using sign, so he has a full-time interpreter with him, which is great. And he's picking up vocabulary like crazy, but both kids, we have to figure out what works for them. So I'm doing a lot of problem solving and learning how to use different iPad programs, learning how to use extremely expensive communication devices that the family has purchased outside and then brings to school, and we have to implement it using very specific constraints on words or vocabulary. So that's interesting. And the big thing about high school, if you're in one of these rooms, you can stay until you're 21 in Kentucky. So I could have kids, and I have 8th grade students right now, so I have anyone from 13 to 21 at this point. And same thing really that Emily said about center and being prepared for grad school. I had 3 years in grad school also. My prep year, I actually took, I would say 50% of the classes I took, I had already had at center under a different name. I was a psychobiology major, so very well prepared, knew the background, and grad school actually, in my opinion, was way easier than center also. And you do a lot of hands-on learning. You learn a lot more when you're in your rotations than you do sitting in the classroom, which is true about everywhere. Trying to look at my notes just to see what else. Also in the school system, one of the things that you have to realize is your caseload in Kentucky can be up to 65 kids. So mine right now is 57, which is a lot for high school setting. And then I do the evaluations, I do the therapy. You have to attend ARC meetings every year for every kid, at least once a year, or whenever a parent or teacher calls a meeting. So not only do I have to see my 57 kids, however they're written up, and most of them are anywhere from twice a week to 6 times a month to, I have one I see once a month for 10 minutes. So that one's kind of random. But then you can sit in up to 7-hour-long meetings about the kids and discussing their goals, discussing their progress, and how we're going to help them. I don't know, Emily covered a lot of stuff, which is kind of nice. It's great because it's all, you go across the lifespan. I've worked in rehab. I've done PRN on the weekends in hospitals. I really enjoy what I do, and I think the ability to move around and do different aspects of speech pathology is a fabulous, fabulous thing for our field. And that's it for me.
Okay, thank you both. Questions? Yeah.
Hello, I'm Amelia. I'm a junior. I am an English major. I've shadowed some speech therapists, speech pathologists in the school system from my hometown and also in hospitals. And I've been to some grad school meetings, and I'm just coming from center. Our GPAs aren't the best in comparison to some of these other people that are going into speech for grad school. And I would go to a grad school meeting and they would be like, oh, our average acceptance GPA would be a 3.8 or a 3.9. And I'm just very concerned that I'm going to apply, but I'm very worried that I'm not going to get it. So any things there?
My GPA was not a 3.8 or 3.9. I can tell you that for sure. But the GRE scores help a lot. Sometimes that is, I know at U of L, I went to University of Louisville for grad school. They pretty much said, if your first number on your GRE is not whatever, I don't remember how it's scored, then you don't have a chance. But also right now, we need people in the field. There are openings everywhere. So some programs are accepting more students. I know my class was only 10. So that's not a lot. And they really do. We need to expand the field, and that's actually a national push from ASHA a little bit.
Yeah, I agree. I think that I honestly don't remember what my GPA was, but I don't think it was 3.8 or 3.9 either. But I do think that it really depends on the grad school, and really take a look closely at different grad schools you're applying to, because usually each grad school sort of has a focus. Some focus a lot on pediatrics, some focus more closely on adults and swallowing, things like that. So see where their focus is and if that kind of lines up with your interest. But also, yeah, I know the University of Tennessee, when I graduated, my class was about 20, and now they have, I actually have a UT student student right now I'm supervising, and their class is over 40. So they are accepting a lot more students and growing their programs in different areas. But I do remember that the GRE was very important. So I would say take one early, and if you are, I would just say take it twice if you can. If you're not super happy with your, if your first score is just awesome, then at least when I got in, that was very highly weighted. Not all grad schools do an interview. Like UT didn't do any kind of interview. They let me come and visit, but some grad schools either do a phone interview or in person. I definitely think the essay and letters of recommendation are really important, and I think that obviously, especially anyone who knows about Center usually knows the reputation there, so I do think that helps. But yeah, I felt very well prepared, so I hopefully that shouldn't be a problem for you. But definitely just apply to several different grad schools if you can.
Thank you.
More questions? Don't be shy. Yeah.
So you both have very different kind of majors coming from Center. Do you think, what do you think would what kind of courses do you think best prepare you to go into this career in grad school?
Could y'all hear that?
Not everything, no.
Okay. She said that you guys have very different majors, and she was wondering what you would recommend as the best course direction, knowing what you know now about the field for somebody to look at.
Emily, you wanna go?
Sure. I don't know that. I think it's just where your interest is. I mean, I felt like the English major was really helpful, English and Spanish, just because of being able to use the language later on, and then the English major as far as the writing skills. But I did have to learn, especially when doing research, to really write a little more scientifically. I was a little too wordy. So I think that definitely just adding, wherever you are, just adding a few more biology anatomy classes would be helpful. But like I said, I didn't feel at a disadvantage at all. Even, with my majors, I felt like, I didn't have any trouble in the classes. I mean, it's a lot of, obviously, learning about language development. I think a lot of different things from Center would fit just because you get a broad spectrum. So if you come from a psychology background, I think there's lots of benefits there. But yeah, most of the classes, you have like anatomy, neuroanatomy, and then once you get into grad school, you get more specific about disorders and things like that. So I really think that there are lots of options, but I think just trying to make sure that you get a good broad spectrum between, sort of language arts and the sciences, biology, anatomy, stuff like that.
And I definitely agree with that, coming from a much more science-based background. I was very prepared, and I had the more scientific writing piece of it, but having Center is great for giving the option of across the spectrum classes. So I think you're going to be prepared no matter which course you choose. I actually had people in my program who were French majors who never had a science class. So she graduated, she does fine, she has a job. So I think wherever you are, as long as you decide this is what I want to do, it's gonna work.
I have a question. Have either of you guys thought about doing private practice speech therapy, or can you speak to that option? I heard that can be, I guess, doable because of the demand.
Yes, I actually for a couple years was technically in private practice, but working with a developmental pediatrician and some psychologists, and we were in a fee-for-service practice. So patients paid out of pocket, and I only got paid for who showed up and who actually paid their bills. I, though, did not luckily have the overhead of owning the practice. I worked very closely in a second job, another job I had, it was called Theraplace, with someone who did own a practice and saw her headaches, and saw the turnover and the lack of pay from insurance companies or the delay in payment. So if you want to do private practice, make sure you have some business background. That would be my number one thing, because if you don't have business background and know what you need to do, then it's going to be really tough. Or have a good mentor.
Yeah, I definitely agree with that. And that's, I've, considered doing private practice, or especially speaking Spanish. I know I've had several schools in the area that have asked me to come and do evaluations for them. So I've thought about that, but again, working for the hospital, they charge all the insurance. I don't deal with any of the billing aspect of it, which is my preference. But if you like that sort of thing and you're really organized and a go-getter, I think that you can make it happen. It's just like with any job, with the hospital, I have full benefits. If you're working for yourself, obviously you don't have those benefits, and then you have to really be careful about calculating everything for taxes and this and that. And then obviously, where I work, I get paid hourly, which is not across the spectrum, but I am like full-time 40 hours, but I get paid for not only the time I see patients, but also the time I document, anytime I'm calling doctors. So there's a lot of kind of freedom and leeway there. I have had some other professionals and friends go into private practice where they work for, like I talked briefly about Tennessee Early Intervention System, so they have to get, approved through the insurances and through the Tennessee Early Intervention, but they go out to homes and see children and their families and provide services there. So that's another option. And some people really love doing the home health aspect of it. You can do it, again, across the spectrum. Some people do it with pediatrics, other people do it with the adult population. So there's definitely lots of opportunities out there. It's just the same as Ashley. I just prefer working under someone and not having to deal with all the business side of it and the money and the insurance and things like that.
What would you say some differences are working in like a hospital environment versus a school environment?
Can you repeat that?
What are some differences between working in like a hospital environment versus a school?
Well, let's see. For me, it's mainly the kids that I see, because with the hospitals here, I worked with adults only, and it's a very quick in and out. And I did hospitals really early on, so I learned very quickly that was not my preference. Adults can be sometimes very mean to you, and as a new grad, that was not what I wanted to do. But I don't know, there was a lot in a hospital for me that did not work. And I knew that I like kids and wanted to work with kids. In the school, I do a lot of collaboration. When I was in elementary and preschools, you're in the classrooms working right there with the kids, figuring out what you do. There are a lot more meetings in a school, a lot more meetings. Huge benefit is summers off. So you can have extra work if you want. You can pick up something else. I technically have 14 paid weeks off a year if you look at it on my salary. But I have 2 children, so I decided that going back and being on their schedule was going to be beneficial. Hospital, I would probably make a little bit more, but this fit my lifestyle a lot better.
And I would say too, and at the outpatient rehab clinic, it's a little different than being in an acute hospital setting. I mean, we are pretty fast-paced. Like I said, I see anywhere from 8 to 12 children a day, but I do get paid and have time in between for paperwork. work a lot with the local physicians, gastroenterologists, different professionals in the area. And I work really closely with the families. So usually the families are coming back into my therapy room, and we're doing I'm doing the therapy with the child, teaching the parent kind of what to do. Like I only did a short time in acute care as a student, but it is very fast paced. Like Ashley said, you're seeing lots of patients in and out. Typically at a hospital, you're going to be working with the radiologist very closely, doing the swallow studies like I mentioned earlier. So it's very technical. So you're watching these videos and you're looking to see what the patient's swallow looks like, and making sure that they're not aspirating, that no food's going down to their lungs, and then making recommendations about the patient's diet, whether or not they're safe to continue with their current diet. You might change the consistency of their food, liquid, different things, and then you work with the dietitian and the nurses to help. But typically you're not going to see patients for very long. You might do an evaluation, a swallow study, and then 1 to 2 treatments, and then the patient's been discharged. So it's very fast-paced, and the caseload goes up and down depending on how many people are in the hospital and how many doctor's orders you're getting to do the evaluations. And I did enjoy working in the hospital, but I felt like, and it is somewhat that way here in pediatrics when we have BD patients who are very fragile, but I do feel like there's kind of more liability, more pressure, just because if you make the wrong recommendation, you're talking about potentially some serious issues if a patient's aspirating or having difficulty swallowing. And so there's a lot more in the hospital setting that you have to know medically, and you really have to be careful working with different patients and the doctors and consult with them, things like that. So I think, like I said, really cool field to have the options, but yeah, it's very, very different in what you're doing day to day.
How much repetition is there day to day in each of your settings? Like, do you do the same thing every day, or is each kid different in the way you approach them? Can you talk about that?
Did y'all hear that?
How much repetition is there from day to day in what we're doing? Is that right?
Yes.
Correct.
Okay. There is some, definitely, but like I said, it's things are always changing. So typically how my schedule is I, for the most part, have the same 8 to 10 patients on every Monday, same 8 patients every Tuesday. Most patients have between 1 and 2 therapy sessions a week. And for the most part, we try to keep them with the same therapist. But for example, today I had 2 patients under 3 that I was working with feeding and swallowing. And then this afternoon, I'll have a patient that I'm working with articulation, an older patient that I'm working on auditory processing disorder, and a Spanish-speaking patient I'm working on language skills with. So week to week, it cycles through typically the same patients, and then usually I have 1 to 3 new evaluations a week. So there is a lot of variety. And here, because we're one of the only 3 centers in East Tennessee that's where we have all 3 therapists, we get a lot of children who have multiple disabilities, or like I said, rare genetic syndromes or different things. So I feel like there's a good amount of variety, especially enough to keep it challenging and always keep me on my toes as far as learning new things. And the requirements for us, for ASHA, the American Speech, Language, and Hearing Association, are that we have to have 30 hours of continuing education every 3 years. And usually I end up exceeding that just because there typically are lots of good learning opportunities and stuff that I'm interested in going to. So I definitely think that it's an exciting and challenging job day to day.
Kind of the same thing with me. I have the same set of kids. They're not on an exact schedule because of the high school setting, really. I can't pull kids out of certain classes. I don't pull them out of certain classes if they're failing. I spend a lot of time trying to connect to the curriculum. I find, vocabulary words that they're working on and how do we work on them. But mine varies a lot because sometimes kids aren't here. Sometimes they go on field trips. Sometimes we do community-based instruction. So I'm out at Kroger instead of sitting in a classroom with kids and using augmentative devices to ask, the cashier, how much does that cost? Or I need help finding this item, things like that, trying to use real world skills since they are in high school and the goal is to get them to live as independently as possible in any way. And that might be in a residential setting, it might be home with their parents, it might be doing a volunteer job versus a paid job. And mine, I vary a lot, but I see the same kids. So it just, and my meetings can take up an extreme amount of time some weeks. So that's,
All right, I have another one. What's it like versus working with a child who speaks, or a person who speaks English versus Spanish, or like just a different language?
Versus Spanish. It's pretty similar. Obviously, obviously there are different syntactical and grammatical differences in Spanish and English, and with bilingual language learners, I have a lot of children here, 2 and 3, who have, some words in Spanish, some words in English, but it's pretty similar as far as what I do. With the really young ones, it's still working on, like animal sounds and simple names and repeating syllables and things like that, and just teaching the parents how to specifically work with them. So in a lot of ways it's pretty similar. It's just knowing and working in those different grammatical sort of markers and characteristics of Spanish. And then I do have some older kids, so that's more challenging, especially when they're in school and learning English. If they're trying to continue to be bilingual, it can be challenging. But of course, I'm not, teaching English. I'm teaching children who have a underlying language disorder, and where their Spanish is their first language. If that's what the parents prefer them to stick with, and that's what we're doing first. And then helping the parent to learn how to work with them at home. So it's overall pretty similar.
and I don't have a lot of experience with that. So I have children at school who are primarily Spanish speaking, but have been in the school system so long that we don't use interpreters.
I know you both said that your clinicals in graduate school prepare you a lot for what you do, but what would you recommend doing before you get to graduate school, like maybe next summer before you start graduate school, to help you be prepared for your classes?
I think, the only recommendation I have, I thought the internship was a great opportunity and great learning experience. I think if you know of any clinics or school systems, if you can just have the opportunity to observe somebody and try to observe speech pathologists in different settings, just to kind of have an idea about what they do. And then as far as coursework, I don't think there was anything more that I think I would have done to prepare that I already had from center. But I think just having the opportunity to really be able to observe someone in different settings would be beneficial, for sure.
I think just talking to anybody, talk to various speech pathologists in various settings across the board. If you think, I definitely want to do private practice, talk to somebody who has started a private practice. If you want to be in a hospital, talk to people in hospitals. And any chance you get to observe, definitely do it.
Last chance for questions. Do you guys have any closing thoughts? You don't have to have them.
Not really. Just if you have questions, feel free to email or call if you need to. I know Center has both of our numbers and email addresses. So I'm happy to talk about speech pathology to anyone. I will try to convince you to go into the field for sure, if you're at all interested. So yeah, I really enjoy what I do.
Yeah, same here. I'd be happy to talk with anyone, email, phone. If anyone wants to come observe, I'd be happy to do that. Yeah, I think it's a growing field. It's a very, very rewarding job day to day. I love what I do coming in, and I would encourage anybody who's thinking about it to further pursue that. So thank you all for inviting me here today. I appreciate it.
Ashley and Emily, thank you both for joining us. Good information. Thank you.
Thank you.
And you guys, if you need their contact information, you can just contact me. You can talk to me at now or email me, Kirk Knott, and I'll be glad to share that. Thank you both.
Thank you.
Thank you.
Yeah, I was like, wait a second.